Hi there, I'm Jen Rice, and I wanted to talk a little bit about testing when it comes specifically to the SARS, COVID 19. And I watched this great webinar last night put on by the Institute of Functional Medicine. Two physicians in particular. One was Dr. Helen Mezier, who has a PhD in immunology, and then Dr. Patrick Hanardy, and their video was great. It was a whole webinar on just testing in general, what it means, where we're at, and I thought it was really, really helpful for me as a PA who's been in practice 15 years, although I'm not screening or working with patients that are symptomatic or being screened. But I thought it was really good for me to know, for me and my family members, friends, neighbors, anyone who may ask questions. So the one thing I want to talk about is that they really nailed down a couple things. And the first thing was there are really like two types of testing happening. There's active viral testing, which is the swab that you see put in the nose. And then there's antibody testing. And the acute phase of the virus testing is where they're looking at RNA strands. And these RNA strands are usually seen in like what they call like read out in real time. So it's called a real-time PCR. And the thing is, there's a lot of false negatives and there are false positives. And what I found most interesting about the false positives is that there's cross-reactivity with 4 different types of strains of coronavirus, because the common cold, other very common type of cold viruses that we get are in that coronavirus sort of so the 4 different strains that are there. So when that's the case, we have to ask the lab what exactly are their validation procedures, because a test is only as good as the sensitivity it has and how specific it can be, right? And so what they were saying is basically, if someone is symptomatic or there is known exposure to someone else who's positive, this is where the clinical discretion comes in, and this is where it's so important to work with, whether you're on a telemedicine platform or with your on the phone or in some kind of visit with your primary care doctor, to have someone involved in really what you're feeling, how your exposure was, and then they can better direct you. But the thing I found most interesting is that because there are 4 strains of coronavirus and not really knowing exactly how the lab is processing, that's why we're getting false negatives and false positives. So the message there is we still don't really know exactly. It's going to go a lot based on symptoms. And then the second thing about antibody testing, and I was super optimistic about this and kind of excited and was hopeful that this antibody testing would just be really, I don't know, something great. But one thing that the doctors reminded us of on the webinar was that having antibodies doesn't mean you have immunity. And that's very true when it comes to having antibodies to anything in our blood. Doesn't mean we have immunity. So that means that antibody testing can be helpful to see if you, it usually is best done at 2 to 3 weeks out from known either exposure or infection. And then again, she kept talking about that the antibody testing is only as good as the lab validation. And she was looking at upwards of 90%, ideally 95% sensitivity specificity. They presented a full questionnaire that you could ask labs. So if you're a healthcare practitioner and you want to reach out to me, I'm happy to share with you that piece of paper that they shared about lab validation. I can send you the link for that. And if you're just someone that likes to do research and wants to know more, you can certainly send me a private message. I'm happy to send you that link also. But I found that the basic take-home message was that the testing isn't it isn't perfect. It actually never really is. In medicine, a lot of times we were always taught, treat the patient, not the lab value. And I think that this is one of the key times where I'm reminded of that again, where treating the patient is definitely more important than treating a lab result, because there can be false positives and false negatives. And so if you if you are feeling symptomatic or you have a known exposure, I think the best thing you can do is to contact your primary care provider or use one of these great platforms that are out there that are allowing for access, so that you can have a real discussion with someone and really kind of go through how you're feeling, so that they can begin helping you with the symptoms you do have and helping you steer in the right direction. So I hope this has been helpful. I know that it does come back to, once again, building up our own immune system, taking care of pre-existing conditions, improving high blood pressure, obesity, and making sure that we're working on things like high blood pressure and cardiovascular disease, and becoming really the strongest versions of ourselves. And yes, some of these, all of these conditions are chronic, but there's no reason they have to get worse. And oftentimes we can improve them dramatically. So if you're interested in learning more about what I do with functional medicine and helping people with their health, please reach out to me. I hope you guys have a great day.